Hey guys, Andrew Lee here, your health insurance guy and also the principal agent over at Health Mutual Network. And I just wanted to make a very important video about something that's been happening within the last 2 months in my office, and it's probably happening to you too. So if this is happening to you, you're definitely going to relate with this video. So what has been happening? So every year, Medicaid, that's generally free $0 cost insurance that's given to you by the county based off of your income. Medicaid seems to be upping their qualifications, their income qualifications every year, which is not a bad thing for the people who like Medicaid, but the issue lies where people are on marketplace policies or a state-based policy, just like let's say a covered California, right? It's like their own state-based exchange, whereas opposed to other states could be a marketplace healthcare.gov exchange. And what's happening is, and this is specifically a big issue in California as well too. What's been happening is people who are right at the cusp of qualifying for Medi-Cal, which is Medicaid in California, and qualifying for a Cover California plan, which is again is a subsidized health insurance plan through the ACA. Those people that qualify at that amount, right, and sort of at the cusp of Medicaid, they have a pretty dang good plan. It's called a cost sharing reduction plan. If you're at a certain income bracket that doesn't qualify you for Medi-Cal, they'll give you more subsidies based off of that income bracket that you're in. So let's say if you're a household of one and you're at around $21,385 to qualify as a single for the Silver 94 plan. Now the Silver 94 plan is a really good plan. The 94, by the way, the number 94, the number 87, or the number 70 or the number 60 is the number, it's the percentage of how much your plan actually covers. So if you see that on your actual plan, that's what that's referring to. Now 94% of their coverage is covered, right? So they'll have $5 doctor visits, less than $1,000 for the out-of-pocket maximum for the calendar year. And also specialist visits are like $8, so it's very, very reasonable. And then the premium itself is extremely low cost. So people love that plan, especially if it's a PPO, right? And they can't go on Medicaid or Medi-Cal because they need a PPO, which again, county-based insurances are generally HMOs. So the biggest issue that people are running into now is, one, they're getting kicked off of the plan that they carefully chose with me in my office, and they're getting kicked off of that because the county, Cal HERES in California, will supersede anything on Cover California if the income from last year didn't match up to what the projected income this year was, right? Because the application is going to ask for the projected income for the following year, for the upcoming year. And of course, we're not fortune tellers, so we don't know all that. But based off of last year's income, if you didn't make as much money to qualify for a subsidized plan through the marketplace or through a state-based exchange, then what's been happening is the county's going in and automatically enrolling him into Medicaid, right? So that's a huge issue for people who have three specialists that they need to go to, and they have a PPO policy. Now they're on a HMO, which with a carrier that the county actually chose for them. So a lot of clients have been not too happy about that. And also, if you're on auto pay and you are eligible for Medicaid, what will happen is, if you didn't respond to any of those Medicaid letters, what will happen is, because those letters will say, yeah, you're awaiting review, or you're eligible now for Medicaid and you have Medicaid. The only issue now being is you can't keep that PPO, let's say state-based exchange or marketplace plan anymore, because the county went in and made the adjustments, right? Turned that into a Medicaid case, right? So now, because of that scenario, if you've been on auto pay and you were getting subsidized, let's say you were paying $7, $8 a month for a subsidized plan. Now you're on the hook for the full amount because you're on auto pay, and now you're not getting subsidized because you're on Medicaid. So what'll happen is the carriers themselves will actually charge the full amount, whether it's 800, 900, $1,000. They'll charge that full amount because the communication between Medicaid Cover California and the carrier sometimes can be lacking. Let's just call a spade, right? I mean, it's two governmental agencies and a huge carrier, right? I mean, they're all going to point fingers at each other and at the broker, which at this point, our jobs are to, customize, the income during open enrollment as to what it's going to be for the rest of the year, not necessarily, and then keeping a close eye on that. But of course, we give out warning emails that the county does on their end for Medicaid eligibility as well too. So I would urge you guys to please, keep that in mind. And anytime you see a Medicaid or Medi-Cal or whatever state you're in, if there's anything that has to do with, a Medicaid system letter, then please take a look at that, because you might already have Medicaid, and if you're on auto pay, then they'll charge you that full amount. So please, please, please pay attention to what you get in the mail. And if you were actually supposed to be on a Medicaid plan, and you didn't want to, obviously you don't want to pay full price for everything. You definitely want to let the carrier know that. But of course, it's not, you don't wake up in the morning every day and just say, hey, I'm gonna check on my Medicaid status. Like, it just isn't what we do, right? It's not fun to do. It's not top of mind. It is just what it is. But I just wanted to give out sort of a quick just a small warning of what is to come if we don't pay attention to Medicaid eligibility documents, and any documents that either come in the mail or through your email, however you opted in to get information. Make sure you do pay attention to that, because if you want to get back on a subsidized plan while you're on Medi-Cal or Medicaid, if you want to get back on a subsidized plan, let's say that PPO plan that you really liked, let's say that Silver 94 PPO plan that you really liked, what you're going to have to do is involuntarily disenroll from that plan. So what that means is, okay, so you really have to understand the distinction between what I'm going to say. This involuntarily disenrollment is you letting the county know, of course, based off of your actual income, that no, I'm actually going to make more money this year. Look at my last two pay stubs. Or they're going to ask for proof of income, obviously. Look at my pay stubs. This year's going to be a good year. Last year wasn't, right? Even though we're only a couple months in, this year will be a good year. Look at my last two pay stubs. Then you can involuntarily get kicked off of Medi-Cal, because now you don't deserve Medi-Cal. You don't deserve it based off of your income. So now you can get kicked off of Medi-Cal or Medicaid based on your income, right? And that is fair, because that's the rules, right? If your income's at a certain amount, then you have to be at wherever your income dictates, right? Whether it's Medi-Cal if it's too low, Medicaid if it's too low, or on a state-based exchange or healthcare.gov plan if it's above Medicaid level, right? So if you call in to the county and say, hey, I want to get rid of this Medicaid, I want to just completely cancel this so I can go back on a subsidized policy, guess what? Here's what they're going to do. They're just going to fully cancel the policy, not really ask any questions. Some of the, the good reps do, but generally most don't. They'll just flat out cancel the policy. And what happens if they just flat out cancel the policy instead of involuntarily getting kicked off based off of income? What'll happen is at that point you won't have subsidies. You go back into your application and it's full price, because you canceled your right to having Medi-Cal, not involuntarily disenrolling based off of your income. So when you call into the county, make sure you have that distinction that you are involuntarily disenrolling based off of your income as opposed to canceling. So hopefully this has helped a lot of you guys, because there are actually millions of people that have been affected by this. So if that's you and you have any questions, please give us a call at 323-844-8471. More than happy to walk you through that and just give you some advice on how to get you back on the policy you want, and a policy that we initially wanted to have. So I wish you guys good luck on calling the county. You might want to grab a glass of wine or something like that. It does take a little bit to reach them, but once you do and you're back on subsidies and you want to do things the correct way and have more good information about how the enrollment process works, and how, like, what to expect moving forward, definitely get an agent, and I'd be more than happy to help. Again, my phone number here at this office is 323-844-8471. Thanks, guys, and please like and subscribe. Thank you.